Ascarism, Ascarism family Ascaridae, Ascarism family Ascaridae. General characters: they three well-developed lip, buccal capsule or pharynx absent. Esophagus is usually club-shaped. Male has paired spicules. Direct life cycle. Worms are commonly called ascarids. Genus Ascaris, Parascaris, Toxocara, and Toxocara species. Species of Ascaris, Ascarid worm. Species of Ascarid worm. Species of Ascarid common name. Ascarisum, Ascarid worm of pig. Toxocara vitulorum, Ascarid worm of cattle, buffalo, sheep, and goat. Toxocara cati, Ascarid worm of cattle, Ascarid worm of cat. Toxocara canis, Ascarid, Ascarid worm of dog. Toxascaris leonina, Ascarid worm of dog and cat. Parascaris equilorum, Ascarid worm of horse. Ascaris lumbricoides, Ascaris worm of a man. Ascarism, Ascarism final host pig. Predilection site small intestine. Largest nematode of pig. Ascarism general characters: male are 50 to 25 centimeter, whereas female are up to 40 centimeter long. 3 well developed lip. Egg are oval shape, brownish color, yellow color with thickened shell, the outer layer of which is irregularly mammillated. Ascarism life cycle: direct life cycle, infective stage, egg containing second stage larvae. Transmission by the ingestion of egg containing second stage larvae with food and water. Ingested infective egg contains second stage larvae hatch in the small intestine and L2 reach to the liver where develop into L3. L3 finally reach into the small intestine via trachea and esophagus. Tracheal route migration. L3 via bloodstream enter into the lungs and tanch final two parasite molds occur in the small intestine. Life cycle of Ascarism: egg in outfishes, some lungs, liver. Ascarism pathogenesis: in the liver, the migrating L2 and L3 can cause milk spot, which appear as cloudy whitish spot of up to 1 centimeter in diameter. L3 larvae follow tracheal route of migration, which result hemorrhagic lesions in alveoli. Ascarism pathogenesis: adult Ascarism less pathogenic intestinal obstruction may be found in heavy infection. Young pigs below 6 months of age are chiefly affected and show signs of pneumonia, Ascaris pneumonitis, coughing, decreased growth rate, diarrhea. Ascarism diagnosis: on the basis of clinical sign, microscopic fecal examination, egg is brownish yellow ovoid with thick shell, the outer layer of which is irregularly mammillated. Ascarism treatment: levamisole, fenbendazole, parental tetrate, piperazine salt, ivermectin etc. are used in the treatment. Controlled treatment of infected pig: regular deworming every 3 to 6 month interval with suitable antihelminthic. House of pigs should be cleaned and feces disposed regularly. Toxocara vitulorum family Ascaridae. Toxocara vitulorum family Ascaridae. Final host: cattle and buffalo. Predilection site: small intestine. Largest nematode of cattle and buffalo. Toxocara vitulorum general characters: male are 25 cm, whereas female are about 30 cm long. Body of worm is soft and cuticle is translucent, so the internal organ can be seen. Extremities are not so narrow. Eggs are subglobular shaped. colorless with thick, finely pitted cell. Toxocara vitulorum. Toxocara virulorum life cycle, direct life cycle, infective stage A containing second stage larvae. Transmission Toxocara vitulorum transmission occurs following route, oral or ingestion of infective egg containing L2, transmammillary or transcholesterol transmission. Toxocara virulorum life cycle. Transmammary infection constitute the major source of T. vitulorum infection for calf. Injection of infective stage containing L2 larvae by calf or adult does not lead to patent infection. Instead, hatched out L2 stage reaches various organs or tissue and remain dormant. Larvae start mobilizing and migrating to mammillary gland during late pregnancy period. Just after parturition, the migrating larvae are shed in milk and lead to transmammary transmission up to 3-4 weeks. Calves soon after birth feed on colostrum and the larvae grow to adult worm in their intestine in approximately 4 weeks. Toxocara vitulorum pathogenesis. Worms are highly pathogenic in calf, especially buffalo calf, below 6 months of age. Partial or complete obstruction of the lumen of gut, digestive disturbance, anemia. Patent period is short and natural expulsion of adult worm start as early as 38 days after birth and by 4-6 months no adult worm remain. Toxocara vitulorum's clinical sign. Worm produce Hysteria colic, mud-colored, foul-smelling feces, intestinal obstruction in case of large number of worms, pot belly, poor bot coat, emaciation and death. Toxocara vitulorum diagnosis. On the basis of clinical sign, gross examination of feces, microscopic fecal examination. Toxocara vitulorum treatment. Parental Pamoate 250 mg per kg body weight orally. Piperazine, fenbendazole, levamisole, etc. are used in the treatment. Toxocara vitulorum control. Toxocara vitulorum infection can be controlled by regular deworming with suitable anthelmintic. In case of calf, deworming will be started at the age of 10 to 15 days and then after every month up to 6 months of age. Regular disposal of feces, separate rearing of adult and young animal etc. Toxocara cat family Ascaridae. Toxocara cat family Ascaridae. Toxocara cat final host cat and wildfowl predilection site small intestine. Toxocara catis general characters. Smaller in size in comparison to Toxocara canis. Posterior margin of the cervical alley from a right angle arrowheaded instead of gradual tapering, lanceolate as in case of Toxocaris leonina. Eggs are similar to the egg of Toxocara canis but colorless. Toxocara cati life cycle. Direct life cycle. Infective stage A containing second stage larvae. Transmission. There are 4 routes of Toxocara canis transmission: oral or ingestion of infective A containing L2, transmammary transmission, paratenic host transmission, parental transmission absent. Migratory phase is found in direct transmission, whereas non-migratory cycle found in transmammary and paratenic host transmission. Toxocara cati clinical sign. Infected cat, especially kittens, reveal blocking of intestine, pot belly, loss of appetite, coughing, diarrhea, constipation, vomiting, poor body condition, etc. Toxocara diagnosis on the basis of clinical sign, gross examination of faces, microscopic fecal examination. Toxocara treatment similar to Toxocara canis. Toxocara control. Toxocara infection can be controlled by regular deworming with suitable anti-helminthic. Female cat should be dewormed just after parturition to avoid transmammary transmission through mother's milk. Cats should not be allowed to play public place or place where other animals defecate. Habit of cats should be cleaned regularly and rodents should eliminate from cat's habit. Visceral larva migraines. Visceral larva migraine VLM. VLM occur in abnormal host, commonly in children, those having the habit of dirt eating, pica, and bonding with stray solid pups, but also in other hosts. Children get the infection by the ingestion of infective larvae or take the food without proper washing of their hands. Larvae of Toxocara canis, mainly Toxascaris leonina, Toxocara Capillaria hepatica, Gnethostoma spinigerum, and Legochelescaris minor migrate into visceral organ or tissue. It causes chronic granulomatous, usually eosinophilic lesions, ocular granuloma, hepatomegaly, intermittent fever, coughing, loss of appetite, etc. Toxocara canis family Ascaridae. Toxocara canis family Ascaridae. Toxocara canis, common name arrow-headed worm. Final host dog. Predilection site small intestine. Highest prevalence have been recorded in dog of less than 6 months of age. Toxocara canis general characters. Male are up to 10 cm, whereas female are up to 18 cm long. Presence of larvae, large cervical ally with gives arrow-like appearance, hence known as arrow-headed worm. Anterior end is bent dorsally. Tail of male worm bears a small finger-like process. Eggs are subglobular in shape, dark brown in color, unsegmented embryos at the center with thick finely pitted cell. Toxocara canis life cycle. Direct life cycle infective stage. Egg containing second stage larvae. Transmission. There are 4 routes of Toxocara canis transmission: oral or ingestion of infective egg containing L2, or follow tracheal migration of larvae similar to a sum. It occurs in puppy of a few weeks to less than 3 months of age. Toxocara canis life cycle: transuterine infection or transplacental or perinatal or congenital infection. In dog over 3 months of age, the hepatic tracheal migration occurs less frequently, and at 6 months it has almost ceased. Instead, only somatic migration of L2 larva, and these remain in L2 stage in organ or tissue. L3 is pregnant bitch. Parental infection occurs. Larvae become mobilized at about 3 weeks prior to parturition and migrating to the liver of the fetus, where they molt to L3 just before birth. A bitch, once infected, will usually harbor sufficient larvae to infect all her subsequent litter, even if she never again encountered the infection. Mobilization and migration of larvae include probably due to alteration of hormonal status during pregnancy stage. Toxocara canis life cycle. Direct life cycle infective stage, egg containing second stage larvae. Transmission. There are 4 routes of Toxocara canis transmission. First, oral or ingestion of infective egg containing L2. It followed tracheal migration of larvae similar to asum. It, it occurs in puppy of a few weeks to less than 3 months of age. Toxocara canis life cycle. Transmemory transmission. L3 larvae are passed to suckling pups via the colostrum and develop directly to adult worm in the intestine of the puppy. There is no migration in the pup following infection by this route. Paratenic host transmission. Dog being predators may eat on rodent having dormant larvae. L2 stage develops to adult stage in the intestine of pups and dogs without migration. Toxocara canis pathogenesis. Most fatalities from Toxocara canis infection occur during the pulmonary phase, and pups which have been heavily infected transplantarily may die within a few days of birth. Larvae are caused pneumonia, pulmonary edema, hemorrhages, etc., whereas adult worms lead to enteritis and occlusion of intestine. Toxocara canis clinical sign: pot belly or tucked up abdomen, coat is dull and harsh, nervous convulsion and diarrhea or constipation, vomiting, coughing, poor body condition, loss of appetite, etc. Death of pups occurs due to heavy parental infection as well as blocking of intestine. Toxocara canis diagnosis on the basis of clinical sign, gross examination of faces, microscopic fecal examination. Egg are subglobular in shape, dark brown in color, unsegmented embryo at the center with thick finely pitted cell. Toxocara canis treatment: piperazine, adipate, pibendazole, parental pomade, diethyl carbamazine, and leomysol are used in the treatment. Control: Toxocara canis infected witches should be treated with pibendazole, which is also effective against dormant larvae in tissue to may prevent parental infection. Floor of kennels should be kept clean, dry, and washed either by boiling water or 3% Lysol solution. Rodents should be eliminated from the kennel. Deworming schedule: puppy second week, 4 weeks, 6 weeks, 8 weeks, 12 weeks, 16 weeks, 6 months, and 1 year. Adult dog twice in a year. Parascaris equirorum. Parascaris equirum. Parascaris equirum family Ascaridia. Parascaris equirum general characters: largest nematode of equine. Male are 50 to 28 cm, whereas female are up to 50 cm long. Worms are rigid, stout, with a large head, 3 well-developed lips. Male tail has small lateral alli and numerous post-cloacal papillae. Egg array egg hierarchical or sub-spherical brownish yellow color with thick and pitted shell. Parascaris equirum final host: horse, ass, pony, zebra, etc. Predilection site: small intestine. Parascaris equirum life cycle: direct life cycle, infective stage, egg containing second stage larvae, transmission by the ingestion of egg containing second stage larvae with food and water. Life cycle similar to Ascaris sum. Parascaris equirum life cycle of Ascarid in falls 10 to 15 weeks. Parascaris equirum clinical sign: fall 3 to 4 months of age, especially suffer from flatulence, fatigue, diarrhea, pot belly, bellying up, and obstruction. Parascaris equirum diagnosis on the basis of clinical sign: Gross examination of feces. Microscopic fecal examination. Egg arrherical or subspherical brownish yellow color with thick and pitted cell. Parascaris ecorum treatment. Levamisole, ivermectin, fenbendazole, morentel, tetrate, and piperazine salt are used in the treatment. Control mares with foal graze, cleanest posture, following stall hygiene, monitor measures, and treat as needed. Treat foal at 6 week interval from 6 weeks of age until 6 months. Ascaridia gelli. Ascaridia gelli, poultry ascaris ascarid worm. Ascaridia gelli, poultry ascarid worm. Ascaridia gelli, final host, domestic and wild bird, location, small intestine, largest nematode of poultry. Ascaridia galli, general character, male are 50 to 76 mm, whereas female are 70 to 160 mm long. Worms are stout, densely white, and esophagus has no posterior bulb. Male worm has 10 pair anal papillae. Egg is oval with smooth shell. Ascaridia galli life cycle. Direct life cycle. Infective stage. Egg containing second stage larvae. Transport hot earthworm. Transmission through. First, ingestion of infective egg containing L2 with food or water. Second, egg are sometimes ingested by earthworm, which may act as transport host. So, ingestion of earthworm containing L2 larva. Ascaridia galli pathogenesis. Young birds under 12 weeks of age are more susceptible to infection than adult birds. Highly pathogenic in chickens of 1-3 months of age, and chickens over 3 months of age are more resistant to infection. Dietary deficiencies such as those of vitamin A, B, and B12, various mineral and protein predispose to heavier infections. Larvae causes catarrhal or hemorrhagic enteric, whereas the adult worm may cause intestinal occlusion and death. Ascaridia galli. Ascaridia galli, clinical sign. Worm cause hemorrhagic enteritis, anemic, emaciation, and diarrhea. Ascaridia galli, diagnosis. On the basis of clinical sign, microscopic fecal examination, large adult worms are found in small intestine during necropsy. Ascaridia galli treatment. Ascaridia galli treatment. Piperazine adipate, mebendazole, tetramycin, phenothiazine. Mixture of phenothiazine and piperazine are used in the treatment. Ascaridia galli control. Treatment of infected birds, regular deworming, regular cleaning of floor, feeding and watering utensil, etc. Segregation of adult and young bird. Heterakis gallinarum, poultry ascarid worm. Heterakis gallinarum, poultry ascarid worm. Heterakis gallinarum, poultry ascarid worm. Heterakis gallinarum, final host, domestic and wild bird, occasion cecum, cecal worm of poultry. Heterakis gallinarum general characters, marked sexually dimorphism, male are smaller and shorter, about 9 mm in length with a unique band tail, whereas females are shorter and longer, about 13 mm in length with a straight tail, and esophagus has large posterior bulb and spicule are unequal in length. Male worm has 12 pair anal papillae. Egg is oval with smooth shell. Heterakis gallinarum life cycle. Similar to Ascaridia galli, infective stage egg containing second stage larvae, transport host at form. Transmission. Transmission through first ingestion of infective egg contain L2 with food or water. Second, egg are sometimes ingested by earthworm which may act as transport host. So ingestion of earthworm containing L2 larvae. Heterakis gallinarum. Heterakis gallinarum pathogenesis. Worms are usually non-pathogenic, but it is important role in is transmission of Histomonas meleagrides protozoa. Histomonas meleagrides protozoa causes enterohepatitis or blackhead disease in turkey. Protozoa remain safe inside the infective egg of the nematode against the lethal effect of the anterior part of the digestive tract of the bird on ingestion of egg by them and reach Zika in viable state. Worm cause nodular tephlitis. Histomonas meleagrides life cycle. Heterakis gallinarum clinical sign. Clinical sign nodular tephlitis, anemia, emaciation, and diarrhea. Heterakis gallinarum diagnosis on the basis of clinical sign, microscopic fecal examination. Small adult worms are found in the ceca during necropsy. Heterakis gallinarum treatment. Febendazole, phenothiazine 0.5 to 1 gram per bird are effective. Heterakis gallinarum control. Treatment of infected birds, regular deworming, regular cleaning of floor, feeding and watering utensil etc. Segregation of adult and young bird. Family Oxyuridae pinworm. Family Oxyuridae pinworm. Family Oxyuridae pinworm. Family Oxyuridae. General characters. Esophagus has well developed posterior bulb. Female worm have long pointed tail. Male has single spicule. Vulva located anteriorly. Direct life cycle. Species host Oxyuris Oxyuris equi, pinworm of equine, horse and donkey. Antrobius vermicularis, pinworm of worm of man. Scirujubinema ovis, sheep and Scarjabinema ovis, sheep and goat. Oxyuris equi, final host, horse and donkey location, large intestine, pinworm or rectal worm of horse. Oxyuris equi, general characters. Horse glass shaped esophagus has a well developed posterior bulb. Female is much larger than the male and have long tapering tail. Young female are almost white in color, slightly covered and with a pointed tail, whereas mature female worm are stale grey or brownish in color with a very long narrow tail, 3 times of the rest body. Male has one pin-shaped spicule. Eggs are elongated, slightly flattened on one side with a plug at one pole. Oxyuris equi life cycle. Infective stage, egg containing third stage larvae. Transmission. Transmission through infection in equine occurs by the ingestion of infective egg containing third stage larvae on fodder and bedding. Oxyuris equi life cycle. After fertilization, the mature female worm crawls out through the anal opening and lay egg in cluster on the skin in the perineal region. Third stage larvae L3 are developed inside egg and final host get infection during feeding or ingestion of egg containing L3. Oxyuris equi pathogenesis. Anal pruritus, anal pruritus produced by the egg-laying female after affected animal rubs the base of its tail against any hard object, causing the hair to break off and the tail acquire an ungroomed red tail appearance. Oxyuris equals clinical sign. Rubbing of tail to get rid of pruritus, which result broken hair and give it a red tail appearance. Oxyuris equals diagnosis on the basis of clinical sign, examination of the perineal region of infected horse revealed cream-colored masses of egg are elongated, slightly flattened on one side with a plug at one pole. Oxyuris equine treatment: levamisole, febendazole, pyrenetyl tetrate, ivermectin etc. are used in the treatment. Oxyuris equine control: good hygiene in stable, frequently removal of beddings and prevent contamination of feed and drinking water with beddings are helpful in controlling the Oxyuris equi infection in horses. Thank you.